All right, so I tweaked my hip yesterday. I'll put the video behind here. I was doing a back squat 5x5 at 70% with 285. Had done a few sets already. This was the fourth of fifth sets. On the third rep, dropped into the hole of the squat. Felt a pretty big pop on the front of my right hip. Didn't really hurt right away when it popped. Just felt kind of weird. Could tell it was something that wasn't a normal kind of feeling. Finished that rep, took a second, got down into the last 2 reps of the set, and again, didn't feel super painful right away, but could tell it was kind of weak already and didn't feel quite right. So didn't do my 5th set, shut it down. Immediately did a little bit of some banded hip mobility work. And just was testing out some of the muscles. Had to get to work, so I worked, kind of let it cool off, just was doing regular movements. When I finished up treating patients yesterday, I then ran through a series of tests on myself, just trying to figure out, does this seem like something that's a little bit more muscular, tendony, maybe joint, like a hip labrum, just in the area of the symptoms, kind of where I felt it and what it felt like. The 2 biggest things that came to mind right away were either something with the labrum of my right hip or potentially a tendon that attaches to the front of my hip, so maybe like a hip flexor tendon, something like that. But good news was, as I went through the day, pain did start to get a little bit worse. I could tell it was starting to swell up and movement was getting a little bit harder with it, but it still wasn't severe. Like I could walk on it, I could bear weight through my leg, so that was really good. So these tests from the first day, from day 0, that was just a few hours afterwards, contracting my hip flexor, or just like contracting my leg to create hip flexion just in standing, was pretty painful. Passive hip flexion, bringing my knee up to my chest, was pretty painful. Bottom of a squat position was pretty painful. Lunging was pretty painful. And anything where I was kind of twisting or making any kind of quick movements, like I was just being pretty cautious walking around. I wasn't really turning or pivoting with any kind of speed or sense of urgency. But other than that, like walking itself felt okay. It had a little bit of pain when I went into hip extension, but it felt more like I was stretching the area. And so then I just kind of let it cool off, and I retested today and did some rehab. So coming in today, hip flexion was a little bit better than yesterday. Still pretty painful, but range of motion was better. Squatting was still pretty uncomfortable. Getting into the bottom position, again, a little bit better, not my normal depth. And then putting my leg back behind me and kind of stretching the hip flexor on that side was, again, pretty uncomfortable. I did some self-assessment, kind of digging around up in that area to see if I could localize where that pain was coming from. Then I did some cupping to try to move some blood into that area, flush the lymphatic system out a little bit. From there, I hit a rehab circuit, which included minute 1 on the echo for 10 calories. Minute 2 was doing some hip flexion isometric holds with a band. And minute 3 was doing some single leg box step ups just with body weight, get some blood pumping around that hip. And then minute 4 was doing some knee extensions with a lean back to try to challenge my rectus femoris and the hip flexor a little more. And afterwards, range of motion, pain were all better.